Welcome to therapy.
I haven't been feeling good. I just haven't been happy.
Well, we have many different types of therapists here.
Okay. Wow, there's so many. Can you tell me the difference?
My name is Hope, and I'm a humanistic therapist. We believe in the power of the person. I won't judge you, and I'll always see the best in you. I'll give you an open-ended response and practice reflective listening so that you can achieve a sense of self-actualization and so you can recognize your strengths instead of your weaknesses. I can offer you client-centered therapy where I will help you recognize your full potential, or a Gestalt therapy where we can focus on the whole of your experience, on the here and now.
Okay, do you honestly think this kind of therapy will help me?
Well, I am all for honesty and being honest. People say that the qualities that we humanistic therapists have are qualities that all good therapists should have. So I think that you will find me and all your wonderful therapists here.
Okay, so what other kind of therapies can I choose from?
I am Freudette. I am a psychoanalyst. I try to bring your repressed feelings that were brought up during childhood to your consciousness. This way, you can deal with your feelings now and move on. I try to make you relax so you can tell me whatever you are thinking. However, when I hear any resistance, I try to figure out why you resisted, and it is usually because you are avoiding a sensitive or emotional topic. I then interpret what you have told me. You may also start to really hate me. This is most likely you transferring your feelings for a family member onto me. However, I do not only fix past relationships, but I can fix present ones by fixing the past ones.
Whoa, that's an interesting approach. I see there's also an intrapersonal therapist. What do they do?
I'm George, and I would help you quickly get out of your depression. Interpersonal therapy focuses on fixing depression. Sessions would be once a week for about 10 to 20 weeks. We would fix the main key issues that are affecting your depression and focus on those. Usually, we address present relationships and how they affect your depression, and vice versa. We also focus on social roles and interpersonal interactions. I hope to find ways to help you deal with your current problems.
Yeah, that sounds like that might work, but wait, problem-solving therapy? That sounds pretty straightforward, but I would like to know the specifics. What exactly is problem-solving therapy?
My name is Anne, and I offer problem-solving therapy, a relatively modern sort of therapy. I believe in the significance of the social context of your environment and the people in your environment. We believe that people develop the issues as a response to social context, and that in order to solve these issues, we must study how to change the social situation in order to produce change. More specifically, what I will do is help you sort and deal with the stress that factors into anxiety or depression. I will help you pinpoint and focus on specific problems that are causing your feelings, rank the importance of each problem, and lastly, I will have you write down possible step-by-step ways to solve them. I don't want to solve your problems for you. I want you to incorporate efficiency and effective problem solving into your everyday life so you can deal with the problems on your own.
That does sound pretty interesting, but I want to hear out the last kind of therapy. Can you tell me what schema therapy is? I've never heard of it before.
Yes, definitely. Schema therapy is basically a combination of cognitive, behavioral, Gestalt, and psychodynamic therapies. We can also add a meditation portion to your therapy if you would like to add a spiritual component to your therapy. It takes advantages of the best parts of each type of therapy and integrates it into one type of therapy, schema therapy. By the end of our session, you will be able to identify and understand your personal issues. Then you will learn how to solve them by tackling the way you think, feel, and act. I will help you go back and fix your early schemas, especially those that hurt you psychologically, as soon as possible. I know you will enjoy a higher level of satisfaction after our sessions. It's the best of all worlds.
Yes, that sounds like the best for me. I was kind of hesitant to come here at first, and I really like the sound of all of these therapies. So schema therapy seems like the best for me because it really combines everything. When can we start?
Question time!
Okay. What are the two main types of humanistic therapy?
There is Gestalt and client-centered.
What is problem-solving therapy centered around?
The social context.
What is the role of a problem-solving therapist?
Their role is to act as a guide or as a teacher.
What is schema therapy?
It is a combination of cognitive, behavioral, gestalt, and psychodynamic therapy.
And last question. How can a patient add a spiritual component to schema therapy?
They can add meditation.
Yay! Hi, Mom.
Hi, how's your therapy going?
I don't know. I mean, it was pretty good. My therapist was kind of weird, though.
Why?
I don't know. She just kept dressing up like different characters, and then she would talk to me. And I don't know. I'm a little bit creeped out, but whatever makes me get better,
Yep.
All right. Bye, Mom. Love you. You should be George.
I'm George, and I would help. I'm Joe, and I would help you quickly get out of your depression. Interpersonal therapy focuses on depression. Oh, that was wrong. Welcome to therapy.
Go to therapy.